How do gastroenterologists treat bleeding ulcers? Bleeding ulcers can be a serious condition, and gastroenterologists have a structured approach to treat them effectively. When a patient arrives with a bleeding ulcer, the first step is to stabilize their condition. This involves checking vital signs and ensuring they have enough blood volume. If there has been significant blood loss, blood transfusions may be necessary. In some cases, medications that prevent blood clotting may need to be paused to reduce the risk of further bleeding. Once the patient is stabilized, the next step is often an endoscopic procedure, known as upper endoscopy. This allows the gastroenterologist to see the ulcer directly and assess the bleeding site. During this procedure, several techniques can be used to stop the bleeding. For instance, injection therapy may be used to constrict blood vessels. Thermal coagulation applies heat to cauterize the bleeding vessel, while mechanical methods like hemoclips can clamp down on the bleeding area. These endoscopic treatments are effective in controlling bleeding and reducing the chance of it happening again. After the bleeding is controlled, medications play a crucial role in healing the ulcer and preventing its return. Proton pump inhibitors are commonly prescribed. These medications reduce stomach acid production, which creates a better environment for healing. Initially, they may be given in high doses, sometimes intravenously, especially in severe cases. After a few days, patients typically switch to oral doses for several weeks. If the bleeding ulcer is linked to a Helicobacter pylori infection, treatment will also include antibiotics to eradicate this bacteria. Monitoring is essential after treatment. Patients are closely watched for signs of rebleeding or complications. If bleeding occurs again, repeat endoscopy might be necessary. In severe cases where endoscopic treatment does not work, surgical intervention or procedures like interventional radiology may be needed to address the bleeding. Additionally, gastroenterologists will look into underlying causes that might contribute to the ulcer, such as the use of non-steroidal anti-inflammatory drugs, smoking, or other medical conditions that could hinder healing. In summary, treating bleeding ulcers involves stabilizing the patient, performing endoscopic interventions to stop the bleeding, using medications to promote healing, and careful monitoring. This comprehensive approach is aligned with current medical guidelines for managing peptic ulcer disease. Always consult with a healthcare professional for proper diagnosis and treatment of bleeding ulcers.